Every year, millions of older adults go in for checkups thinking they are doing the right thing. You trust your doctor, you follow the instructions, and you hope these routine tests are helping. You stay safe. But here's something many people over 60 don't realize: some of these vary. Same tests can sometimes put extra stress on your body and quietly raise your risk of stroke or other health problems. In today's talk, we are going to walk through some of the most common medical tests that older adults go through, things you may have already experienced yourself. I'll explain how they can sometimes increase your stroke risk, what signs to watch for, and most importantly, how you can stay safe without giving up the care you need. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. And if you've ever felt a little dizzy or weak after a medical test, share that too. It might help someone else realize they're not alone. Point 1. CT scans with contrast dye. Now, on the surface, this sounds harmless. The doctor injects a special dye so they can see your organs, blood vessels, and tissues more clearly. It helps them check for things like clots, tumors, or other hidden problems. That sounds useful, right? But here's what many people don't know: the dye itself can sometimes put stress on your body, especially if you're over 60. For some seniors, this dye can cause sudden changes in blood pressure. In a few cases, it goes down too quickly and makes you feel faint. In others, it spikes up too fast and puts strain on your blood vessels. And if you already have high blood pressure, kidney problems, or heart disease, the risks can be higher. There have been cases where seniors walked out of the hospital feeling fine, but within a day or two, they experienced dizziness, blurred vision, or even a small stroke. I remember reading about an 81-year-old gentleman who went in for a simple abdominal CT scan. Everything looked normal, but just 2 days later, he had a minor stroke. The doctors believed the dye temporarily raised his blood pressure and triggered a clot. This doesn't mean CT scans are bad, they can save lives, but it does mean they shouldn't be done just in case. They should be done when truly necessary. So, what can you do? Before agreeing to a CT scan with contrast, ask your doctor, is this test essential for me right now? Share your full health history, especially if you've ever had kidney issues, high blood pressure, or reactions to medications. And always ask if a non-contrast scan or an ultrasound could be enough. Sometimes, a safer option is available, you just have to speak up. Point 2. Treadmill stress test. Another common test that many older adults are asked to take is the treadmill stress test. On paper, it sounds simple: you walk on a treadmill while hooked up to a heart monitor so the doctor can see how your heart reacts under pressure. For younger people, this usually isn't a big deal. But for those of us over 60, especially if you have high blood pressure or heart problems, this test can be risky. Here's why. As the treadmill speeds up, your heart rate rises, your blood pressure climbs, and your blood vessels are forced to handle extra strain. For someone with already delicate arteries, this sudden stress can be too much. It may trigger dangerous spikes in blood pressure, irregular heartbeats, or in rare cases, even small tears in the blood vessels of the brain. These changes don't always happen right there in the doctor's office, sometimes the effects show up hours later. I think of a woman named Margaret, 74, who had lived with high blood pressure for years. Her doctor suggested a stress test, just to check in. Halfway through, she felt dizzy and her chest tightened. They stopped the test, but the next day she suffered a minor stroke. Doctors believe The sudden rise in her blood pressure during the treadmill exercise was enough to rupture a small vessel in her brain. Now, does this mean you should refuse a stress test? Not at all. But it does mean you should talk to your doctor first. Ask, is there a safer way to check my heart? In many cases, a nuclear stress test, which uses medicine instead of exercise, or a simple echocardiogram can give the same answers with less risk. And if you aren't having chest pain, shortness of breath, or other symptoms, ask whether the test is really necessary right now. Sometimes, waiting or choosing a gentler option is the smarter move. Point 3. Endoscopy with sedation. This includes things like checking your stomach, esophagus, or even a colonoscopy. These procedures are often done under sedation, meaning you're given medicine to help you relax or sleep during the test. And while that sounds easy enough, sedation can quietly create risks for older adults. Here's the reason. Sedation often lowers blood pressure and slows circulation. For a healthy, younger person, that usually isn't a big deal. But if you're over 60, and especially if you're taking blood thinners like aspirin, warfarin, or Plavix, the combination of lowered blood pressure and thinner blood can increase the chance of bleeding or reduced blood flow to the brain. In some cases, this can even trigger what's known as a mini-stroke, or a transient ischemic attack. I'll share an example. A 76-year-old woman went in for a routine colonoscopy with sedation. She had no symptoms going in, but 2 days later she started slurring her speech and had trouble walking steadily. At the hospital, doctors found she'd had a mild stroke. They believed the drop in blood pressure from sedation, combined with her daily aspirin, had created the perfect conditions for a clot to travel. This doesn't mean endoscopies are bad. In fact, they save lives by catching cancers and other serious problems early. But it does mean you shouldn't agree to one just because it's time. Ask your doctor, do I really need this test right now? If the answer is yes, remind them of all the medications you take and ask whether sedation is absolutely necessary. In some cases, lighter sedation, or even none at all, may be an option. The key is knowing your risks before you go in, so you can make the safest choice for your health. Point 4. MRI with contrast dye. Another test that sounds safe but carries hidden risks is the MRI when contrast dye is used. The dye, often called gadolinium, helps doctors see things more clearly inside your body, like blood vessels, nerves, or tumors. But here's what many seniors don't realize: as we get older, our kidneys naturally slow down. And since your kidneys are the ones that flush this dye out, the chemical can sometimes stay in your body longer than it should. When gadolinium lingers, it may cause problems. Some seniors experience confusion, dizziness, or a kind of brain fog after the test. In rare but serious cases, it can lead to a condition where the skin and tissues harden, called nephrogenic systemic fibrosis. This condition is more likely if you already have kidney disease, even if it hasn't been diagnosed yet. Take Harold, a 79-year-old veteran. He went in for an MRI with contrast because of back pain. He didn't know his kidneys were weak. 2 days later, he felt lightheaded, foggy, and weak for almost a week. Only afterward did his doctor discover he had stage 3 kidney disease, which made it harder for his body to clear out the dye. Harold later said, "If someone had just tested my kidneys first, I would have asked more questions." So, what should you do? If your doctor orders an MRI with contrast, ask, "Can this be done?" without the dye? Often, the answer is yes. And if contrast is truly needed, ask for a simple kidney function test called a GFR before the scan. That way, you and your doctor can know if your kidneys are strong enough to handle it safely. Remember, the MRI itself isn't the danger, it's how your body handles the dye. With the right precautions, you can get the answers you need without risking your health. Point 5. Carotid artery ultrasound. Now let's talk about a test that sounds completely harmless, the carotid artery ultrasound. This scan checks the big blood vessels in your neck that carry blood to your brain. It's quick, painless, and doesn't involve needles, dyes, or machines that make loud noises. Sounds like the perfect just in case test, right? But here's the catch: if you don't have symptoms, this test can sometimes do more harm than good. Here's why. As we age, it's common for some plaque to build up inside the arteries. A scan might show 50% or even 60% narrowing. That number sounds scary, and many seniors are quickly referred to a surgeon. The next thing you know, you're being told you need surgery or a stent to fix the problem, even if you've never had dizziness, weakness, or vision changes. The truth is, not every bit of plaque needs to be removed. In fact, for many older adults, it's safer to manage the condition with medication and lifestyle changes instead of rushing into surgery. There was an 82-year-old woman named Helen who went in for a routine checkup. She felt perfectly fine, but her doctor ordered a carotid ultrasound just to be thorough. The scan showed narrowing, so she was sent for surgery. Sadly, during the procedure, she suffered a small stroke and now lives with weakness on one side. Later she said, "I wish I had known that waiting and monitoring might have been safer." So here's the lesson: if your doctor. Point 6. Fasting blood tests. Finally, let's talk about something almost every senior has done: a fasting blood test. Your doctor might tell you, don't eat or drink anything after midnight, so you show up in the morning with an empty stomach. It seems harmless, but for older adults, going too long without food or water can quietly put stress on your brain and heart. Here's what happens. When you fast more than 10 to 12 hours, your blood sugar can drop too low. Add in the fact that many people skip water too, and now your body is dehydrated as well. Together, low sugar and dehydration can make your blood thicker, raise your blood pressure, and reduce blood flow to the brain. That's why some seniors feel dizzy, faint, or weak after a simple blood draw. In a few cases, it has even triggered what doctors call a TIA, or mini-stroke. I think of Samuel, age 73. He went for his yearly labs and decided not to eat or drink anything at all before his test. On the way home, he blacked out at a stoplight. Thankfully, he wasn't hurt. But doctors later confirmed he had suffered a mini-stroke, likely caused by dehydration and low blood sugar. So what can you do? First, ask your doctor if fasting is really necessary. Many modern tests for cholesterol and blood sugar don't always require a full fast anymore. If fasting is needed, make sure you drink water beforehand. Hydration keeps your blood flowing smoothly. Try to schedule your test early in the morning so you're not going without food for too long. And once the test is done, don't rush into errands or driving. Bring a light snack, sit down, and eat right after the blood draw. That small step can make all the difference for your safety. Point 7. Stopping blood thinners before procedures. Here's something many older adults don't think twice about: stopping blood thinners before a small surgery or even a dental procedure. Your doctor or dentist might say, don't take your Aspirin or warfarin for a few days so you don't bleed too much. It sounds simple enough, but the truth is, stopping these medicines suddenly can create a dangerous rebound effect. When you stop taking a blood thinner, your blood doesn't just go back to normal, it can actually become more likely to clot for a short time. That means your risk of a stroke may rise in the very days you're off your medication. For seniors who already have heart disease, high blood pressure, or a history of clots, that pause can be enough to tip the balance. I'll give you an example. Margaret, age 68, was on a low-dose aspirin after a mild heart attack. Her dentist asked her to stop taking it before a tooth extraction. She skipped her pills for 3 days before and 3 days after. On the 5th day, she developed a headache and numbness on one side of her body. A CT scan